ट्रेनिंग एंड रिसर्च इन आयुर्वेदा जामनगर। एंड ये बताते हुए मुझे बहुत प्रसन्नता हो रही है कि मैडम इज गोल्ड मेडलिस्ट in BAMS and MS, and she is also holding a diploma in yoga and hospital management. She is presently working as an assistant professor in Department of Prasuti, Tantra and Stree Roga at ITRA Jamnagar. और मैडम ने एक बहुत इंस्ट्रूमेंटल रोल प्ले किया है, बहुत सारी CMEs को मैडम ने कोऑर्डिनेट किया है। 13 से ज्यादा पेपर प्रेजेंटेशन नेशनल और इंटरनेशनल सेमिनार्स में की हैं। मैडम ने 36 से ज्यादा रिसर्च पेपर्स इन पीयर रिव्यूड नेशनल और इंटरनेशनल जर्नल्स में पब्लिश किए हैं। और ये हमारे लिए बड़ा प्रसन्नता का विषय है कि आज मैडम इस चर्चा में हमारे साथ एक्सपर्ट स्पीकर मैम ने ज्वाइन किया है। बहुत बहुत स्वागत मैम आपका। और मैं ये भी बताना चाहूंगा इस मंच से कि मैडम मेरी गुरु रही हैं ITRA जामनगर में, जब मैं वहां प्रसूति तंत्र स्त्री रोग में अध्ययनरत था। बहुत बहुत स्वागत मैम। ओवर टू यू मैडम सिपिका स्वाति।
मैडम अनम्यूट कर लीजिए।
Arun, am I audible? हेलो
जी जी
हाँ जी मैडम, यू आर ऑडिबल।
मैम थोड़ा नेटवर्क प्रॉब्लम है।
नहीं मैम, यू आर क्लियरली ऑडिबल नाउ।
ओके ओके। सभी को मेरा नमस्कार। और मैं तहे दिल से विश्व आयुर्वेद परिषद के जो भी ऑर्गेनाइजिंग मेंबर्स हैं और प्रोफेसर योगेश मिश्रा सर, सीनियर के द्विवेदी सर, कन्वेनर सुनीता मैम, को कन्वेनर सुनीता जोशी मैम, कोऑर्डिनेटर्स अमृता मिश्रा मैम एंड को कोऑर्डिनेटर डॉक्टर अरुण, मैं सभी को थैंक यू बोलती हूँ कि मुझे ये मौका देने के लिए कि इस मंच पे मैं अपना जो भी अनुभव है सुतिका परिचर्या पे उसको आप सबको के समक्ष रख सकूं और शेयर कर सकूं। इसके लिए वेरी वेरी थैंक यू। सो मैम मैं अपना स्लाइड शेयर करूं?
यस प्लीज मैम।
मैम शेयर हुआ? यस
नहीं मैडम अभी शेयर नहीं हुआ है। हाँ अभी शेयर हो रहा है मैम।
ओके, स्लाइड शो कर रही हूँ मैं। अरुण इट्स ओके?
जी मैम बिल्कुल बिल्कुल मैम। अभी स्लाइड शो उसमें नहीं है मैम, सॉर्टर व्यू में है।
किया है मैंने अरुण, उसमें
हो
नहीं आ
जाता
रहा
है मैम, थोड़ा टाइम लग रहता है।
फिर से ट्राई करते हैं। स्लाइड चेंज हो रही है?
नहीं हो रही है मैम, नहीं हो रही है मैम।
ओके
अभी हो रही है मैडम,
अभी हो रही है
जी।
अभी हो रही
स्लाइड चेंज हो रही है ना मैम?
जी जी।
स्लाइड शो मोड में है ना?
जी नहीं अभी सॉर्टर व्यू में है।
सॉर्टर में है हाँ।
मैम ये मेरे लैपटॉप में तो मैंने किया है स्लाइड शो।
मैम थोड़ा सा
problem.
टाइम लैग होता है, वो हो
Okay,
जाएगा.
shall we continue with this?
Yes, yes.
Okay.
Yes, ma'am.
Thank you, ma'am. Thank you. So my topic is Sutika Paricharya in present scenario. And while we were discussing with Dr. Arun, so on which topic should I speak? So I was thinking to speak on something gynecological topic, but Arun saying, ma'am, everyone talks on gynae topic, so please take some ops topic. And Sutika is already your PhD topic. My PhD thesis work is on Sutika. So literally this topic is very close to my heart also. So for today's presentation, I have selected this topic. So let us start with that. Our Acharya has told that Stree hi moolam apatyanam Stree rakshati rakshita. And this sloks means a lot. What they are trying to say that females or women is the base or root of the offspring, either the world what Srishti which has been created by the God, and among them of all the rights what God has given to a woman, the greatest is to be a mother, and it is the I think the happiest moment in a life of a female. So, and it is very crucial and very important time also. So, what WHO say that in a health report, they have published that poor maternal condition accounts for fourth leading cause of death for women worldwide. Suppose we never think that this poor maternal care may lead to such mortality rate in females after delivery, because they have positioned on fourth position after HIV, malaria, and tuberculosis for death among women in worldwide. Puerperal women whose body is already exhausted by dhatushay, vatavritti, and physical and mental exhaustion caused by pressure requires comprehensive management to promote her health status as well as protect her from the disease of puerperium, because we know that many puerperal complications occurs during this time. Why this Sutika Paricharya or puerperal care is needed? Because we know when we see the prevalence of puerperal related disorder, a long list is to be seen. Like postpartum depression among Indian women is 22%. We never think, or it is never been reported about the psychological well-being of Sutika or lady in the postpartum time. But one renowned publication has been there on the PubMed by Ravi et al. Upadhyay, which shows that 22% of Indian women are facing psychological issue in delivery, after delivery time, postpartum depression, what we call. And there are prevalence of lactation failure also. And there are many more complications like back pain, sepsis, and urinary tract infections, which occurs in puerperal time. So we know that among developing countries, as India is developing country, 99% of all maternal death occurs, and maternal mortality rate
Excuse
is.
me, madam.
Yes,
Sorry,
ma'am.
sorry to interrupt, ma'am. The slides are not moving.
Slides are not moving.
No, madam, they are not. Yes, now it shows.
Now they are.
Yes, now they are. Yes, yes.
Okay, it's
Yes.
moving, ma'am.
Yes, this is the need slide, right?
Yes, ma'am.
Yes, so now it's moving. So you can please continue. Thank you, ma'am.
Okay. So by looking at the serious issues of maternal mortality, WHO has set a goal to reduce the global mortality rate between 2016 to 2030. And looking at this global, to reduce global mortality rate and aim of WHO, Indian government has also recognized the importance of pregnancy and childbirth. Thus, government has included many welfare programs like Janani Suraksha Yojana, Rashtriya Bal Suraksha Karyakram, and many more are going on and running by our government to provide maximum and utmost care during pregnancy and after delivery to women. And meanwhile, we all know that physical and emotional consequences of childbirth, from injuries to recurring pain and trauma, it can be debilitating if we cannot manage it, and it are often highly treatable if right care is given at the right time. So the care, puerperal care, and Sutika Paricharya is the need of the today's era. So first we will have a short and brief look on the puerperal it has been defined into, we can categorize into 3 phases: immediately, just after birth of baby, within 24 hours, and early up to 7 days, and remote, it extends up to the 6 weeks. What changes occur in puerperal phase? When we see there is recovery of wound is going on, hand-to-hand hormonal changes going on of female body, involution of organs, and evolution of breast. Many more things goes on one hand in hand at one time in a female body. So all these things like anatomical changes and physiological changes, everything occurs at one time after delivery of a baby. When we see the changes in uterus, there are changes in uterine vessels, cervix and lower segments, involution of uterine body, endometrial regeneration is also going on, and placental site involution also occurs. And I have just shorted out that if we see after 4 weeks of delivery, uterus should regain, it means after 1 month, it should regain its non-pregnant state. It means the proper involution of the uterus should be achieved if proper puerperium care is going on normally. And these are the shape of the cervix, which changes after delivery gradually. And lotia, it's very important, and we can say it is the mirror of the postpartum diagnosis also, and prognosis also if some disease occurs in puerperal phase. We divide it into 3 phases: rubra, serosa, and alba. Rubra is first few days, and there is sufficient blood to color it as red. And after 3 days, it becomes progressively pale. And after 10th day, after about 10th day, due to leukocyte and reduced fluid content, lotia assumes a white or yellowish white color. What we see normally in puerperal phase. What is the significance of lotia? What by seeing the lotia in every delivered women, we ask how many pads they have changed, or what is the color of lotia, and if there is any smell or not. We just vigilantly take the history after delivery from the very first hour or very first day in postpartum phase. Because we know that lotia serosa is persist to some weeks after birth. It may indicate late postpartum hemorrhage. And lotia alba, if it is continued beyond few weeks, it means pale yellowish white color secretion is there along with lotia. It indicates any type of genital lesion. And if there is offensive or udder or changes to greenish color, it indicates puerperal sepsis or puerperal infection. So by seeing the color of lotia, we can assess the status of the uterine condition or involution. Many blood and fluid changes also occur at the same time, because we all know that pregnancy is a hypercoagulable state and there is hemodilution. So to back up all these things, to revert back to pre-pregnant state, many changes occur in the female body. And by 2 weeks, these changes have returned to normal non-pregnant value if everything is okay. And looking for some postpartum complication, if care is not given properly, patient might face puerperal pyrexia, sepsis, subinvolution. We all know this complication which may occur during puerperal phase: UTI, breast complication, abscess or engorgement, puerperal venous thrombosis if things go very worse, or puerperal emergency, psychiatric disorders, all these things. And when we look about the breastfeeding, it's also an important part of puerperal system. And that we know that it provides exclusive breastfeeding provides lactational and venereal benefit to the patient. And this increased prolactin level, it inhibits ovarian response to FSH also, and it suppresses the release of LH also. So there is no menstruation and there is no ovulation. So we can see that how breastfeeding now, everyone and even government also, we are celebrating breastfeeding week, and they are promoting mothers to do exclusive breastfeeding, and they are telling mothers that it is not beneficial for the baby, it is beneficial for the mother also, because it helps in active involution of the uterus, and it helps in decreased risk of many acute and chronic conditions. Even breast, many studies have been published which have been saying that breast cancer chances are more in that females who are doing exclusive breastfeeding during puerperal phase. So breastfeeding also gives a very much important health aspect to the female in the puerperal phase. Let us look and talk something about mental well-being. And this mental, everyone talk about the wound healing, they talk about the physical strength, but no one takes care about the mental well-being of the mother, through which emotional and psychological condition mother is suffering or mother is going on. Not even their family members taking care. They are asking how you feel after delivery, how you are feeling. Are you feeling low or you are in good mood? No one asks, because all the concentration shifted in the pregnancy. Everyone takes care of the mother, but just after delivery, all the concentration of the family member as well as the lady itself, mother itself, shifts to the newborn. And their mental well-being due to physical exhaustion and emotional exhaustion are most of the time ignored. And many a times this leads to very distinct type of psychological disturbances. And like postpartum blues in some patients, it may can seen as PPD, postpartum depression, and in some patients also it may lead to postpartum psychosis. There are very minute difference between these three categories, like blues, depression, and psychosis. Psychosis is very severe condition, but we can just learn or see that in postpartum blues, mild depression are there, depression, PPD, severe depression, and in postpartum psychosis, psychotic symptom will appear in the mother. They will even the condition are very much worse, and we have seen many patients. They are just coming to our OPD, and they are telling, I don't want to feed my baby, I don't want to look at my baby, I don't want to just take care of my baby. So much depression and psychosis are found in the females, and many are one hypothesis is also there that this postpartum psychosis symptoms, these are suppressed by a proper puerperal discharge, and if female is doing proper breastfeeding in proper manner and a proper way. This is one hypothesis which has been published in PubMed. So they were telling that if there is proper puerperal discharge, while we can say, if we can correlate in Ayurveda, proper Garbhasya Shodhan is there, Loshia is proper puerperal discharge is there, proper care is there, and if lactation is proper, so this protects having a defensive mechanism on the postpartum symptoms, psychological symptoms. And because many a times these cases are go unreported, we don't even know that what is the psychological condition of the mother after delivery. So because these PPD prevalence is increasing day by day, so we should take care of psychological well-being of mother also after delivery. What I have told earlier also, that Dr. Ravi Prakash has they have done a systematic review and meta-analysis, and they have told that 22% of Indian mothers are suffering from this PPD. And when we see our patients, our delivered patient, we hope that okay, everything is okay. Very rare we ask our patient, are you happy after delivery, how you are doing? Because many times being a doctor, we have not many duties, but this is I think this is our duty also. So we should, at least we should ask our patient how her mental well-being is after delivery, because it has been mentioned in our shastras also that kaya, mansa, manas, or both health should be there. Not only kayic health, manasic health is also very important. And these are the objectives for normal puerperium. Let us shift to our Ayurvedic portion. We all know, we are very well known with this term, Sutika. We know the definition. After delivery of placenta, we call the lady Sutika. And the synonym Acharya Shushruta has told, Nivrit Prasuna. And when we see about the Kal, there are little bit variation among Acharyas. Kashyap has told about 6 months. Maximum Acharya has told about 1.5 months, and Bhaumisha has put it as 4 months. What changes occur in Sutika Sharir in Sutika Avastha? It is very important to understand the whole Sutika Paricharya. And on this 3-4 concept, the whole Sutika Paricharya has been built. We all know that due to Garbhavritti, Pramahan, Vedna, Rakta Nishruti, all the Sarir of Sutika, it becomes Sarir. Sunita is there, Dhatu Shay is there, Shitila Dhatu, Agni Mand, and Clay. This is the condition where Vata and Kapha dosha has in predominant state in Sutika Avastha. And if we tell that there is one discussion among Tika also, that either it is physiological or pathological, it is a physiological state, but it is very crucial in which at any phases this physiology may get converted into pathology. That's why Acharya has told to follow Sutika very vigilantly, and Acharya Kashyap has also correlated Sutika with Jeerna Vastra, or which can be tear any time if we will not take care. And many Sutika Kalin life-threatening vyadhis also occur during this time, because women become extremely debilitating physically and mentally. So in Sutika Avastha, body cannot withstand if doshas get vitiated, or either due to severe Agnimande and Vata Prokopa. So many fatal Sutika rogas can occur at this time. And Acharya Kashyap has also categorized Sutika Roga, many various type of Sutika Roga in Kashyap Samhita. So Sutika Avastha, it is a delicate state between normal state and disease state. So one balance should be maintained by following proper Sutika Paricharya. If this balance is disturbed, then many disease can occur during perpetual phase, and we all know that these all diseases are Krichishade and very hard to treat due to Sharir Shunyata of Sutika ladies. When we see, when we look on the Nidana, when we just have a glimpse on Nidana of Sutika Roga, what has been told by Madhav Nidan, Mithya Upchar. It means if one lady is not taking proper ahar and vihar. And Sanklesh, in one tika, Sanklesh, it has been quoted for stress also, or in somewhere it has been quoted by Mithya Ahar Vihar also. Visham and Ajeen Bhojana. So these 4 are major Nidanas which cause Sutika Roga. And if we see the Lakshan, Angmar, Jwar, Kam, Pipasha, all the purpureal complication, what has been told in conventional therapy also, we can see and we can correlate all these symptoms in that perspective. So, and when we see what are the Sutika Roga Samprapti, we all know due to Sarir Shunyata, there is potentially decrease in Dhatu, and it all leads to Sutika Roga. And Krichishade, why they have told Krichishade, all the Sutika Roga, due to Cheen Mans Bal Agni, because in this Sutika Kal, there is Mans Cheenata, and there is decrease in loss of appetite, Agni is decreased, and Bal is also decreased. So when we will see the Sutika Paricharya, we will see all the Sutika Paricharya move around these 3 principles, that to promote Bal in the patient and to promote Agni in the patient. So whole Sutika Paricharya is based on this concept, to promote Bal and to promote Agni in Sutika. Whatever ahar, whatever vihar Acharya has mentioned, everything has the same gist to promote Bal and Agni of the patient. Because due to Cheen, Bal and Agni, any disease or anything which occur in Sutika, it is Krichasate. Coming to the Paricharya, which has been told by different Samhitas or our Acharyas. As I was telling, that the principle is Balavriddhi Agni Deepan, as it is Vata Pradhan state, so obviously Vata Anulomam, Garbhashay Shodhan, and Stani Pravartan. And all this is achieved by these 3 pillars, Oshad, Ahar, and Priha. So let us see Ahar first. What ahar different Acharya has been quoted during Sutika Kal. When we see Acharya Charak, first he has told about the Chaturasnehi Pan, with Deepaniya Dravya, Panchakola Chudha, like Pipali, Mola Chabechitra, and Shundi. And after Susning the Yavagu, he has told, medicated with above drug for 5-7 days. And after, when there is Agni Dipti, when we assess, although Charak has told about 5-7 days, but we have to apply Yukti here. If our patient has telling and he has improved appetite, then we should move on Grihan Chikitsa or Apyayan Chikitsa. If patient take more than 7 days, so for more days we can extend this Deepan Pachan Chikitsa. If we will give or Grihan diet, when her appetite is low, it will cause some meningitis symptom, or it will cause Ama Lakshan in her body. So first of all, Agni Vriddhi is very important in initial phase. Same Acharya Sushruta has told, but in spite of Chaturasneha, he has told to take these things with Gudodak for initial 2-3 days. And after 2-3 days, he has mentioned about Sneha Vagu and Shiraya Vagu with Vidari Gathadita. And from 7-8 days, that Apyayan Chikitsa, Acharya Charak has told, he has not mentioned clearly, but Acharya Shushruta has clearly mentioned that from 7-8 days onwards, Jangal Mansura can be given if patient can take it. And Kol Kulat cooked with sali rice from 7-8 days can be given in Sutika Gal. And when we see Acharya Ashtang Chandra, there is mixture of both Charak and Shushruta concept. Lagu Ahar, meat soup, Jangal Mansura, use of Yo, Kol Kulat from 4, 6, 7, 8 days onward, he has mentioned. Acharya Kashyap, he has told Sutika Paricharya in very elaborating manner, and he has quoted to take Mand initially for 6th or 7th day, and we know that Manda has property of Agni Dipti, and it has also one very good property of Kled Vinasini. That's why after Panchakam or after Virishan, also we in Sanskrit we give Manda, because it has very good property of Agni Dipan and Kled Vishodhan, which is very much important during Sutika phase. And initially he has told about Ravan Rahit Yavagu for 3 days, and after that we will shift from Kulat Yush and Tasne and Salavan things you can give. And one special thing Acharya Kashyap has many times patient asked, what vegetables can we take, what I can take potato, or I can take leafy vegetable. One reference I just seen that Acharya Kashyap has told Grit-based Kushman and British, he have quoted to give, which can be given in Sutika. And when I was searching the property of Kushman, we all know that it has many good extract which works on mental well-being of a patient. It is very good with the shaman, Kushmanda, and Medhir. Kushman is one of the best drug which can be considered as Medhir. So look at the beauty of Sutika Paricharya, what have been mentioned by the Acharya. It is not only the physical strength. They have, whatever they have mentioned, if we will look deeply, vigilantly, we can see that they have given the preventive measures to just cope up with the physical and mental trauma what we face or what a mother faced during puerperal phase. Same like Acharya Harith has given some little bit different concept, like they have he has told Lagnan for 1 day, and after that good semen with Nagar Haritki he has told. We know that Visist Paricharya has been according to Desh and Kal. Acharya Kashyap has mentioned in Anupdesha, Sneha Sevan, and Jangal Desh Sneha Sevan, in Anupdesh Mand Prayog and Shvedan Nivat Sevan. And according to the gender of child, he has told that in male Tel Pan should be there and female Grit Pan should be there. When we see, most of the Acharya has told about the Sneha Pan during Sutika Paricharya. Most of the Acharya has mentioned. What are the benefits of Sneha in Sutika Paricharya? If we see that Grit, Tail, either Vasamaja, these are, especially Grit, these are Vatpiti Shama, having Balle and Rasayan property. Agni Deepak also, when we consume it as someone is saying, and Rakt Vikar Nashak and they have Yogvahi property. Whatever medicine we will give along with that, it will work as a vehicle and it will spread it in all over body. And we know that these all repeat serves as carrier for all the fat soluble vitamins, which is A, D, E, and K. And this A, D, E, K vitamins are play a very crucial role in wound healing. They help in cellular differentiation. They also have antioxidant defense mechanism, and vitamin K especially, it promotes coagulation at the site of wound, and it promotes the wound healing. So this was the concept behind giving Snehapan in Sutika Paricharya. And the main concept that I have told, that increase of Bal and Agni, because it promotes Agni also, Sneha, and it promotes Bal also. And if we see it in present scenario, so it justifies the thing that it helps in wound healing also, and it provides strength. And also he has many essential fatty acids, omega-6 as well as omega-3. And one article has already been published that omega-3 and omega-6 has very crucial role during pregnancy as well as after delivery also. They prevent the postpartum depression. So this was the concept, although it was not revealed that time when they have discussed the Sutika Paricharya, but we can, if we will look into the scientific explanation, then we can find the beauty of our Sutika Paricharya, what have been mentioned here. And when we will look into the Vihara, many things has been told by different acharyas like Udar Abhyang, and Shushut has told especially the Balatel Abhyang, Parishek with Vathar Oshad, the perineal area should be Parishichit with Vathar Oshadigan Vathar. And Udar Pattabandhan also been mentioned by some of the Acharya, because all this have significant value and significant role during Sutika Kaur. And when we see the Acharya Kashyap, he has mentioned some new things like Sutika should use Rakshon thing, and that he have told about one to sit on leather bag which should be filled with warm balatel, which provides proper Shvedan, and after that Shvedan with balatel Asandika. She should take bath with water and take rest. And he has also mentioned about the Yoni Dhupan. And we know that Yoni Dhupan has very good property in wound healing. These are some pathyapats, general pathyapats, which we should prescribe in our patient, like she should use lukewarm water to drink also, and for snan also, and adequate sleep whenever needed, and whenever she can extract time from the baby care, she should have try to sleep properly. Udar Western should be done with oil and vegetables, and she should practice ominous by reading good readings, chanting, and hearing mantras. And many apathya's which has been mentioned by Acharya, like Vyam, Krodha, all the mansik bhavas should not be just consumed, or these shok, bhay, krodh, all should be avoided. Atap sevan, any type of panchkarma, diva swap, it should be avoided. Sheetal vayu, anything which aggravate vayu, it should be avoided. When we see the benefits of this, we are first coming to the Abhyang. We all know that Balat and Tail Abhyang. And in our practice also, we ask our Sutika if she has normally delivered just after delivery from very first day, and they can just practice this Abhyang on lower back as well as legs also. So when Abhyang is given to Sutika, it may be either Sthanik Udar or Sarvodayik Abhyang is also given. And it is traditional practice also in many areas of India or different region. They used to give different type of Abhyang with many types of oil in traditional practices. We will see later on. But in Shastra, Balatel has been mentioned. It is with Abhyang, it is Vata Nashak, Rasayan to Mans Dhatu, it helps in Mans Dhatu Grahan. Shramar also, it tones of the pelvic floor, all the muscles, back muscles, tissue, and relieve the muscle spasm. And Abhyang at lower back helps for proper drainage of lochia also. Because we all know that if there is not proper flow of lochia, the uterus might have been filled with clots and with lochia, then it may further go, because when if blood or lochia is filled inside the uterus will itself try to expel it, and in this process the contraction will start and patient will feel more and more pain. So Abhyang will facilitate proper drainage of lochia. So pain will also relieve. Yoni Abhyang, it tones up the vagina, perineum, and prevents laxity and prolapse, and it alleviates pain and it helps in vaginal and perineal wound healing also. So this all the Abhyangs helps in toning up the muscles, relieving the stress, and relieving the pain which goes after the delivery. And if we'll see Yoni Dhupan, it maintains the proper hygiene and it also keeps the wound healthy, and it will hasten the healing process. And what drug we are using in Yoni Dhupan, it has also their own effect, like Glucoglue. They will give its own effect also, and Dhupan has itself has own benefits. And Udar Western, we all know that it prevents vitiation of Vata dosha by compressing hollow space. It helps in maintaining the tone of abdominal muscle walls, and it provides support to the back and abdomen. And if proper Udar Western is done, it relieves backache also, or prevent further backache in patients also. So Udar Western is also very important during Sutika. Coming to the Sutika Snan, some Acharya has mentioned Sutika Snan or 10th or 12th day, and they have mentioned various type of jala, like Matahar Dravis Jala, Patradi, and Nirgundi Patra and Patra Shikru Patra, and it has been practiced in different regions of India also, in traditional Sutika Paricharya. What it does, it is if we use lukewarm water, it helps in pacifying the Vata dosha, and warm water itself relaxes the muscle and the nervous system also. And due to Ushna Guna of water, it facilitates the proper functioning of Vata dosha and brings the sense of calm and stress free. Whatever drugs which has been told by Acharya, like Pipli, for Shul Prashamana, some drugs has been mentioned by Acharya, like Panchpol, Marich, Ajmota. These, we all know that these all drugs help works as analgesic and helps in pain alleviation in Sutika patients. Let us see some traditional postpartum care which has been practicing in different regions of area. While I was searching for some matter during my PhD work, I have gone through this. I have searched many articles. I have searched many theses, and then I come to know the beauty of Sutika Paricharya, what traditionally has been practiced, and in different parts of region of India, different Sutika Paricharya has been going on traditionally. So as we know that, and there are very much resemblance with our Ayurvedic Sutika Paricharya, what Acharya has been mentioned. Because we know that one of the quotes says that Ayurveda is a Vyavhar Ayurveda. So I was thinking that it's very much true, that whatever Acharya has written, the same, it was very much practiced during that time era in the society. So same thing, many things they have quoted from that practical use also. So if we will see in Kerala, it is very rich in traditional Sutika Paricharya. They have wide range of ahar, vihar, and they are using many traditional preparations also, what they are giving during Sutika Paricharya. And during first 3 to 4 days, if you will see, they give a special combination of medicine, adrak, aridra, hingu, and honey, or drone pusti with good. See, Gudodak has also been mentioned by our Acharya also, and these Shundi, Marish, Pipli, they have also mentioned. And the same thing they are practicing also in Kerala. And they are very much using lehe preparation with chincha, kera keshar. They prepare uli lehe. Uli I have especially mentioned here. Uli, English name, Sanskrit name is Palandu, and it is onion. And they are using very much in Sutika Paricharya, because we all know that it has Digan Pajan, Garbhasha Shodhan, Vata Shaman, and it is very good Vedana Sthapak drug, and Stan Nivardhan also. And it helps in proper flow of local discharge. And it is used as medicine also in Sutika Kal and as a food also. And it helps in regulation of menstrual cycle also. If we will see the content, you can see Methiga, Palandu, Lasunam, Tal, Til, Talam, and Narikil. So all these components boost the Agni and boost the bal in Sutika Kal. So, and many food preparations are also there. And the one in Bihar, one local thing they used to practice Mukutu, what we call it. Simply means three things. When we it is a combination of three things. So for Abhyang, they give combination of coconut oil, either sesame oil and turmeric powder. They mix all the three things with each other, and they use it for Abhyang in Sutika from the very first day of delivery. So it is very good reference what we can take and from traditional practices in Punjab. Many simple things, all the same things, massage, exercise, all this. And there are very restrictions. One thing I got here that they avoid Sutika to wear yellow cloth, and the newborn baby also to wear yellow cloth. When I was searching we have some people also from Punjab, they told that to avoid Kamala. It is not scientifically proved, we can say, but they assume that Sutika should not wear any yellow cloth, or newborn baby should not just carry any yellow cloth, because there is many chances of being having Kamala. I think it should be why this things is practiced, like to avoid if child is suffering from that time physiological jaundice and he is wearing yellow cloth, it might be little bit problematic to discriminate, or sometimes some new clothes just they bleed color also, and if new cloth is there, so this might be thinking before avoiding this yellow color cloth. In Rajasthan also, same jaggery is being boiled in the milk, and they make shira, and they add the shunti and moong dal with all these things. So jaggery, what I have found that jaggery is a common practice in every part of India of traditional care. In Gujarat also, here very much good practice of is there in Sutika Kal, like they used to Vyveden water they used to give during Sutika Kal, or they also used to give dill water and methika pani for drinking after delivery, and they prepare soont laddu, and they use topra. It means dried coconut powder, and they prepare topra pak here with grit, lots of grit, dry fruit, shunti, pipli. They used to put in that, and it's supposed to provide strength to the female, and it is also supposed to provide proper lactation and stanivardhak properties also. And one main thing here is famous here. This traditional katlu they are giving here, and it is a combination of many drugs and as well as many spices. And for 1.5 months they are giving to all Sutika ladies. Same when we see Tamil Nadu also, they same hingu methi with pan jaggery they used to give to the patient for 15 days to improve digestion. And if we see in Jammu Kashmir also, then chai and Kashmiri pill shot, pink salty as famous. And again they are giving methi seeds and desi chawal cooked in desi ghee to enhance breast milk. So whatever we see, wherever we go, the gist is the same, to improve the Agni and to improve the Bal in Sutika. And there are very much resemblance with the Ayurvedic Sutika Paricharya, what is our text. So coming to the benefits of all this Sutika Paricharya, what we have seen, it is not merely it is going to improve the conditions in mother, or it is providing just physical and mental. It overall improve. It also improves the quality of life, overall Sutika well-being. So when we see the Ayurveda, 3 Visishta Acharya has mentioned Charya, like Dincharya, Ritucharya, but in women they have specially mentioned 3 Visishta Paricharya. because they know that these 3 times are very crucial in each and every woman's life. Like Rajaswala Paricharya, when she is mensurating, after coming in reproductive, when the Garvini Paricharya, when she is pregnant. And at last they have mentioned Sutika Paricharya. Why they are called Paricharya? They are a special Paricharya. Because this 3 times is very crucial time in a female life, and utmost care is needed. That's why they have beautifully described this all 3 Paricharyas, and it should be followed, and it should be applied, and it should be applied in our life also, and it should be applied for the use of social well-being also. Because we know that when we see this in Sutika Paricharya, it overall improves physical and mental well-being of a Sutika. It relieves pain in episiotomy wound. That's why if pain is relieved and there is bulk, there is decrease in stress and fatigue. So mother will be able for early ambulation, and she will be able to take care of her also and her baby properly also. And if there is successful lactation, it helps to develop good bonding with newborn, and it improves overall physical health by increasing appetite, quality of sleep. It decreases backache, constipation, and lower abdominal pain by Garbhasha Shodhan, and it prevents many type of complication, UTI, sepsis, many things. So these all things, will lead to improved quality of life in Sutika Kal. And this improved quality of life will just having prophylactic effect in preventing many type of Sutika Vyadhi, which has been mentioned by Acharyas. If they are not doing proper Sutika Paricharya and not following, so many Vyadhis can occur. If combined effect we will along with Sutika Paricharya and Path we will follow, we can avoid and prevent many Sutika Vyadhis. Look, we will see at last some glimpses on drugs, what has been properties of drugs which are being used by Acharya during Sutika. Panchakola is being frequently by many of the Acharyas, Shruti, Pipali, Chaturshatra. When we see the property of these drugs, it's not that it is only having Agni Deepan property. If we see its scientific correlation, we see like Pipali has been used by all of the Acharya, and if we see the property like Piper longum, they have shown antimicrobial activity against many bacterial as well as fungal pathogens, and it has cardioprotective agent also. It is work as cardioprotective agent because it is a non-competitive thromboxane A2 receptor antagonist, and it suppresses platelet aggregation, so it will suppress any type of clot formation and clot dislodging also, because we know that one of the major complication in peripheral phase is peripheral cardiomyopathy, which many patients, many women face due to failure of heart to pump or to cope up the required demand after delivery. So cardiomyopathy, it's not that it is not prevalent in many maternal mortality rate is due to cardiomyopathy. So this Pipli is giving cardioprotective effect also, and many animal studies has been also done which shows that it helps to inhibit the platelet aggregation, and thus helping in cardioprotection. And if we see the antidepressant benefits of Pipali, the picorin, what we know that it's the main component, it is also have antidepressant property through inhibition of monoamine oxidase, and it was isolated from ethanol extract from the fruit of Piper longum using a bioassay guided method, and thus represented a promising pharmaceutic therapeutic candidate as antidepressant. And so we see how beautifully they have just used these drugs during Sutika Kal, and this is preventing from the disease. We can see here it is preventing, promoting her psychological well-being also, and physical well-being, and preventing many Sutika Kalin Vyadhis, these drugs. Shunti, we all know that, and very good anti-inflammatory and analgesic effect. Because Shunti is a potent inhibitor of COX-1 and COX-2. So it gives potent analgesic effect also in Shul and work as Shul Prashaman. And Shunti also has cardiotonic activity, and we all know that it improves the contraction, or it improves the health of the heart muscles also. So we have seen that how this drug, which has been mentioned by Acharya at that time, has scientifically nowadays it has been seen that okay, this drug is important, this drug is beneficial in this way, this drug is beneficial in that way. But what Acharya has written, they have written. But now with the help of science, we are exploring more and more. We are knowing more and more our science in a evidence or scientific manner, and one main thing what we is very much important during Sutika Kal is uterine involution. Whatever drug, we use many drugs empirically, like we are using Dashmukwa, we are using Panchakol, Jirak Pak, we are using Amritastra, we are using Secharadi. Many things, many quads, many drugs we are using. So one of the more so important aim in Sutika Paricharya to just achieve proper uterine involution, because it is very vital part of postpartum recovery. Because if proper uterine involution will be there, it will prevent the postpartum hemorrhage, it will prevent excessive bleeding, and it proper involution reduce the risk of infection also, because the uterus undergoes significant changes during pregnancy because of the placenta, because it carries the fetus also, and all these vessels are open, all the wounds are open, there are many abrasion on the uterine walls, and there are very much risk, and patient is predisposed for many type of infection if not care is not done. So as soon as uterine involution starts, it's in healing process also, and it starts sealing the vessels also, it starts sealing the wounds also. So it helps in reducing the bleeding also, and it helps in reducing the chances of infection also. And again, involution will restore the uterine shape and size to its original pre-pregnant state, and it's essentially very optimum for future reproductive functioning of the female. It allows to prepare uterus for future pregnancy. So it is a well-stored uterus is more likely to support a healthy pregnancy in future also. So proper uterine involution should be achieved, and it is very important during Sutika Kal. So while we justify our today's topic, Sutika Paricharya, in today's scenario, what we told, it has significant importance, as for several reasons. It has been giving a holistic health approach, it has been giving a natural healing process, it has been giving prevention and recovery of many postpartum complication and faster recovery from child-related stress and fatigue, and it helps in proper bonding and emotional support between the mother and the baby, which plays a very crucial role in prevention of postpartum depression, because it is vulnerable period of emotion and psychological issues. And it has been giving long-term benefits also, because both mother's health and child health, if it will be okay, then it will affect the future reproductive health of female also. So Sutika Paricharya, what has been mentioned in our Ayurveda, it offers a structured approach to postpartum care that complements medical intervention, as well as it promote overall health and well-being of Sutika. Now, at the last, I just want to share some special finding what I got in my, and I will be very much feel pleased to share with you. I have taken in my PhD topic, thesis topic, Sutika Dashmul and Pratap Lankeshwaras, under the valuable guidance of Lakshmi ma'am. We have taken Sutika Dashmul apart from traditional Dashmul, what is being used mostly in Sutika. So in this Sutika Dashmul, it is mentioned in Behatra the Ratnavali, and it is combination of Laghu Panchmul and Brihat Panchmul has been replaced by Sechar, Prasharni, Shundi, Guruji, and Musta. And if you will look into the property of this 5 drugs, Prasarani, Sechar, Shundi, Guruji, these all have Pitta Shamak properties, and Sechar, Prasarni, these both 2 drugs have very much potent analgesic effect also. So I found that this Sutika Dashmul was rationally more useful than traditional Dashmul what we use in Sutika Paricharya. And along with that, I have also used Prachep of Pratap Lankeshwaras along with this Sutika Dashmul Kwat. And I have used 250 mg 250 mg Prachep in 30 ml of Sutika Dashmul Kwat. And as I have told that it has Aam Pachan, Chul Prashman, Garbhashay Shodhar and Rasayan property. And if you will look to the beauty of Pratap Lankeshwaras, it is herbo-mineral drug. 1-Vyakpal is major ingredient, which has a very much crucial role in Garbhashay Shodhan and Garbhashay Shankochan, as well as it contains Abrak Bas, which is also used as Medhya Rasayan, and thus it acts on Mano Shrotas also, that thus functioning in the mental well-being of Sutika also. And this Sunti, Musta, Guruchi, Sechar, these all have, these are breaking the Samprapti of Sutika Avastha, which may not, if it is not taken care, it may lead to Sutika Kalin Vyadhi like Kled Vishushan, Agni Deepan, Vata Shaman, and Kled Nisharan. And I would like to share some very good findings what I have got in this study. We have many patients. Because we were talking about uterine involution. I have one modern co-guide also, and ma'am told that we don't have proper uterine involution agent in contemporary science. So I have shared result here in how beautifully these drugs are, our drugs are working on uterine. See, one G6 patient was delivered in our ward, and after delivery, her uterine shape was, volume was 660 cc. It means her uterus after delivery was feeling probably like 5 months pregnancy, 22 weeks. And if you will see the sonography result, after 15 days of delivery, it is reduced to 360 cc. And after when she have completed 45 days course of this Sutika Paricharya drugs along with Pathya, her uterus was completely involuted to 96 cc, which resembles with pre-pregnant state. And the list goes on. Many examples are there. You can see 226 cc, 2114 cc. Many patient, one of the patient has retained product. She was delivered outside in some hospital, private hospital. She came for Sutika Paricharya to our OPD, and when we have done her sonography, they were, madam, our sonologist just advised to do DNC, as there were some retained product of conception. Some products were left, either it was placenta parts or something, so they have also advised for DNC. But I have just given her this Sutika Dashmul Kwat and Pratap Lankeshwaras for 45 days. After 15 days of sonography, her USG also revealed that there was no any product left, and her uterus was clear and properly involuted also. You can see 60 cc, 66 cc, and it is just comparable to just one just pre-pregnant state uterus size. So this is the beauty of Ayurvedic drugs, or what Paricharya has been given by our Acharya. So we got very good result with these drugs, and it gives very promising result in uterine involution, as well as backache, as well as low shell discharge. No any patient have, because I have taken one controlled group also, in which we have given amoxicillin and iron calcium. So many patients, when we have done sonography, their uterine involution compared to uterine involution of patient taking Ayurvedic drug, they are very, although involution is physiological process, so in that group involution was also there, but the uterus has never came or never achieved the pre-pregnant state properly. And in many patients, endometrial fluid collection were there, and if uterus was involuted 200 up to 200 cc or 175 cc, that much involution was achieved maximum. So we can see that our Sutika Paricharya, what our Acharya has mentioned, has at par and has got beforehand, because in no any contemporary science this type of beautiful Paricharya has been mentioned to take utmost care of Sutika or female during this crucial phase of life. So we should promote and we should be proud of these Visist Paricharya, what our Acharya has mentioned, and we should use it and we should promote it for the well-being of society. Thank you. I hope this speech will be beneficial, to all of you.
Thank you, madam, for the very excellent presentation. And it was indeed in detail. And what I liked the most was your elaborate description and emphasis on women mental well-being, which is indeed the need of the hour, and we practically see this difficulty in our OPDs and IPDs. So thank you very much. Now I would like to request our convener, HOD Prasuti Tantra Stree Rog Vibhag of BHU, Dr. Sunita Suman Madam, our mentor, to kindly express her views about today's presentation and the topic. Inviting you, Madam.
Amrita ma'am, Sunita ma'am has also done thesis on this Sutika, you know.
Okay. Acha.
Yes, ma'am.
That's nice.
I have gone through ma'am's thesis while I was searching for my thesis work. And I think she has done on Panchkol, so ma'am has done thesis on Panchkol.
Acha. That's nice to know. Madam, am I audible? Are you there? Sunita madam? Sunita madam had joined. I could see her, but she wasn't traveling. So I wonder
whether...
Yes,
ma'am had initially. I have seen her.
Yes. Sunita Joshi madam? Sunita Joshi madam, are you here? She is the co-convener of this
Yes.
Sambhasha Prasuti Stree Rog. Sunita Suman and Sunita Joshi madam, I guess they are not there. They were there actually, I think, but now they are not there, I think. Madam, are you there? Dr. Sunita Suman madam and Joshi madam? I can't see them, I think. Okay. Thank you very much, madam. Anybody would like to express their views on today's, or anybody has any queries or doubts or any explanation or any thing that they would like to highlight on this topic? You are most welcome. All our esteemed faculties and students who have joined. You have any queries? You are most welcome.
There is a question in the chat box. What's the benefits, as Kashyapa mentioned, about Vishishta Paricharya for Sutika? Those who have given birth to girl and a baby boy like Dale and Grith, share your knowledge about it.
Yes, we know that Acharya Kashyap has mentioned some Visist Paricharya. According to Desh, we already know that in Anop he has mentioned, in Jangal he has mentioned Sneha Upchar, because in Jangal Desha, Vatapradhana Desha is there, so Sneha will be utmost beneficial in that. Regarding this thing, either girl or boy, this discrimination now, and I have not got any articles also on that. Why he has given different snehapan during different sex which of the fetus while delivery. But yet I hope it will come in the future, and we will be able to explain it on some scientific evidence that okay, while baby girl or baby boy, why there is discrimination in snehapana. But already Snehapana benefits I have told why we used to give in Sutika. But discrimination according to sex, I have never got anywhere, while I have thoroughly searched many reviews and many articles, many things during my PhD work also. But I have not gone through any scientific explanation of this, why he has discriminated according to sex. That's Sneha. If you will get, I will be very happy to just learn from you people also, because I have not got any explanation yet. Ma'am, you have got, Amrita ma'am, anywhere, like why this discrimination is there? I have never got this, why in baby girl he has told different Sneha, and in baby boy he has told different Sneha. I've not got yet.
No, actually, we don't have this detail, but sometimes many of our times it happens, madam, that many times currently we don't see the evidence for the some topics or
Yes,
some
that's
discussion.
why.
But later on, maybe it may come out to be like we will be able to
I
find.
just, my perspective, I think it is related to Somita of Shukra and Agneta of Arthav, somewhat. It is the
Yes.
matter of research and discussion, but like in baby girl, Agneta is there, and in baby boy, Shukri is there, so Somita is there. So I think it can be, or it may be correlated in somewhat perspective, in this perspective.
Yeah,
Because
actually, ideally, we don't have evidence, but we can very well
yes,
correlate because we know that there is fundamentally there is a constitutional difference
yes,
between the male and the female cells, and the chromosomal level also we find there is a difference. So maybe in days to come we will be able to get the evidence of it, because many studies which were later thought to be non-evident in the days to come, and the recently also we get to see many evidences based on the references of our texts and
yes,
Ayurveda. Like for example, the very recent example is that of upavas or fasting.
yes, I'm intermittent fasting. What?
Yeah, earlier it was considered to be non-scientific, but later on we see that there was a Nobel Prize and there are many awards being granted to people who proved the evidence of upavas chikitsa. So
Yes.
similarly, we may have evidences in the days to come, but for timing, we can very well we can correlate the constitutional difference between the male and the female cells to be the cause of this discrimination, as I can say. That may be one of the reasons, because acceptance, and there are many points where we find the difference between the male and the female physiology, anatomy, and even psychology.
Psychology
So
also.
psychological, although we say that male and female are same, but there is very well demarcation, and we can very well demarcate the difference between male and female in many aspects. So let us be practical and scientific while considering the male and female equality. So maybe because of that there might be some factor because of which there might be this difference. That is what I feel. Anybody who Anybody has anything to say in this regard, or any other queries? Any questions?
Ma'am, another question in the chat box is, ma'am, can you elaborate on practical usage as to the dose of Snehapan and the time of Udaraveshtan?
Look, Udaraveshtan should be practiced just after delivery when patient is comfortable. As soon as you will start practicing Udaraveshtan, it will be helpful. It will give its beneficial effect. If you will start it after 2 or 3 days and already Vata Prakopa is there, because the concept of Udaraveshtan is that as well as placenta and a fetus is delivered, there is Shunyata. Akash is there, and Vayu has property, it will fill the empty space. So to avoid this thing, so just after delivery, when patient is shifted in our ward, we just tell the patient to practice this Udaraveshtan, and it is very beneficial also. And the practical of uses of Sneh according to the dose, look, it depends on the patient Agni, and sometimes it depends on the Kal also. And again, the patient is either from Jangal Desha or Anudesh. Here in Gujarat, as it is Jangal Desha, Sneh uses are very much prevalent in day-to-day practice also. Every day they use that much of oil in their food. We can, if you will be used in Andhra Pradesh, it will be very little bit, very much problem to our GIT. But here, as it is Jangal Desha, it is patients are or persons are habitual here, and it is the demand of the area or demand of the Desh. So you have to judge according to the Desh also, and according to the Kala also. If your patient appetite is good, then if you can start with proper dose like 20 ml or 10 ml, you can give. And if appetite is low, then that Kashyap, initially you go for with Mand and Gudura, then you start this Sneha. You have to use your yukti, because many acharya has every acharya has given different perspective of this Sutika Paricharya, and why it has been given. It has been given you should apply your yukti according to your patient, according to your area, desh, and according to the kal. Then you have to adopt accordingly that particular thing.
Ma'am,
So
this
we cannot
question
say that
comes-
50 ml or 20 ml. We cannot decide the dose practically like this.
This question was from Shivani Shri Madam, and she wants you to elaborate how all these protocols which are mentioned by you are applied in practically.
Ma'am has written and some more points on how you are practically applying the protocols mentioned. Yes, practically, ma'am, I have told that practically in our ward just after delivery, we used to give some Udar Western, what I have told. And after delivery also, we used to give Ajmoda water. Practically, I am telling what we are practicing here. We used to ask our patient to drink Ajmoda water because Ajmoda, we all know Dipni, Pachni and carminated property also, and it helps in stool prashaman also. So we asked our patient to drink Ajmoda water. Even when I was doing MD in BHU also, even in LSCS patient also, when they are allowed orally, we used to give Ajmoda water initially. Patient will start taking sip by sip Ajmoda water. And trust me, ma'am, it will give very good benefit to your patient. It will increase the intestinal motility also. It will improve the digestion appetite also, and it will help in Shula Prashaman also. And after that, in food here in Gujarat, it is practiced. While coming to the Har Shiro, they used to give Bajra load Shiro. Shiro, I mentioned that it is flour roasted in ghee, little amount of ghee and coconut, dried coconut. These things are put in it with jaggery water. So we ask our patient to follow traditional ahar vihar, what they prescribed by the elders. And coming to the drug, we used to give Sutika Dashmun after initially Dashmun was given, but after research work and since initial also, Sutika Dashmun is being practiced here. And we used to give Bharangi Trikatu with good Parsi Kiavani. We used to give for proper perpetual discharge. We also add Palatal Abhyan and we add Yograj Kukulu also in perpetual phase, in Sutika phase, to just avoid this infection and prevent many complications also. So these things we are practically using. Udar Western since first day, we ask our patient, and for promotion of lactation, we tell the patient to use Topra Pak, which is being practiced here in Gujarat. And if drug is needed, then Shatavari Yestu with Shanti we are giving here. So these things are practically what we are practicing here in ITRF. And if any complication occurs, ma'am, like UTI or something, then we treat accordingly, according to the symptoms. But these things are generally is being practiced here.
I have a question, madam. May I go ahead?
Yes, sir.
Ma'am, many a times patients come to us after taking abortion pills, and they continue with the bleeding even after the abortion. So is Sutika Paricharya is contextual in those cases? If yes, then how to use or practically apply Sutika Paricharya in mifepristone and misoprostol induced abortion cases?
Look, Arun, when we are talking that when patients come to our OPD after having Garpat or Garbhashav, and if she is bleeding properly, there can be two conditions. Na? Either they came to your OPD after having DNC, or either they will come after taking MTP pills. They have not gone through any sonography, and it is not clear either RPFC is there or not. But in both of the conditions, I have seen Sutika Paricharya should be followed. And it should be followed for the whole entire periods. It's not that either for 1 week or 15 days. After looking at the effect of Sutika Dashmal and this Pratap Lankeshwaras, I have started giving this drug in DNC cases also. And because I have shared one In RPOC patients also, I started using this Sutika Dashmul and Pratap Lankeshwara. It gives very good effect. And I think in my perspective, it should be followed for whole 45 days if patient can follow. It will be beneficial because the whole hormonal changes has been same as it is in pregnancy. And it depends on the condition also, like either it is 5 months or 3 months or the duration of pregnancy also, the continuation, it also depends. But I usually, in my patients, I used to give it for 45 days. I prescribe the same drug, Sutika Dashmul and Pratap Lankeshwaras, in that patients also. And it helps in proper local discharge also. And many breast tenderness and breast engorgement symptoms, they are also reduced by giving this, following this Sutika Paricharya. And it also helpful in just preservance of further future pregnancies, because it will help to revert uterus in normal pre-pregnant state. So I think it should be it is beneficial to follow Sutika Paricharya in pills-induced patient also. But sometimes DNC may be needed after giving, because it depends if the RPOC is adhered or it is the baby fetus size is more. Sometimes medical curettage is not working, there is failure. But we have to advise our patient, or we have to do DNC, we are advising our patient. But after DNC, same, we follow the same Paricharya and same Pathya Palan.
Thank you, ma'am. Over to you, Amrita ma'am. Amrita ma'am.
Anybody, if anybody wishes to express some views or questions, otherwise we can, I can see Dr. Sunita. Dr. Sunita, is it Dr. Sunita Suman madam, or I don't know, Dr. Sunita, I can see in the chats, in the this thing, participant list. Else we can proceed with the vote of thanks. I would like to request Dr. Arun Gupta sir to kindly proceed with the vote of thanks.
I'm really thankful to all my elders who make it a point that we must continue our Stree VAP-Sambhasha from the platform of Vishwa Ayurveda Parishad. I'm really thankful to all the elders, our honored Surinder Chaudhary sir, our Yogesh Shukla sir, Anil Shukla sir, and everybody who is behind this platform. And I'm really thankful to our convener and co-convener madam. उनको शायद कुछ अर्जेंट काम से इस प्लेटफॉर्म से जल्दी जाना पड़ा. आई एम रियली थैंकफुल टू आवर एक्सपर्ट स्पीकर फॉर टुडेज प्रोग्राम, मैडम सिपिका स्वाति. उन्होंने अपना ये टाइम स्पेयर किया बिकॉज आई नो शी हैज 2 kids to look after her doing her all the duties. और मैडम 8 बजे तक आप हमारे साथ हैं. मैं आपका बहुत बहुत आभार प्रकट करना चाहूंगा, और आभार प्रकट करना चाहूंगा हमारे इस मंच का जिस पर हमारे स्त्री और प्रसूति तंत्रज्ञ जुड़े. और मैं बताना चाहूंगा कि एक बार पे हमारी स्ट्रेंथ 75 भी हुई. आई एम रियली थैंकफुल टू ऑल ऑफ यू. विद सच अ शॉर्ट नोटिस आप सब लोगों ने इस कार्यक्रम की शोभा बढ़ाई. और अंत में मैं अपनी कोऑर्डिनेटर मैडम अमृता मिश्रा का आभार प्रकट करना चाहूंगा कि उन्होंने बहुत सुंदर तरीके से इस कार्यक्रम का संयोजन किया. बहुत बहुत धन्यवाद आप सबका इस कार्यक्रम को सफल बनाने के लिए.